Hello, listeners, and welcome to Anyone Can Move. This is your host, Caroline Gerhardt. I think that today's topic that we are talking about with our special guest is really important. It is something that every dancer and almost every human, I dare to say, might experience in their lifetime. Um, what this person specializes in, and I just am so excited for everybody to listen to this really candid, honest conversation that we had. So, our special guest for today is Lesley Parrish. She is a physical therapist who has recently begun working specifically with dancers. And so, we had such an incredible conversation, and I think that everybody is really going to be able to get something from it that even if you're not a dancer, you can apply it to your own life just regarding taking care of your body and listening to your body and knowing that we all have our limitations and that it's okay to listen to our bodies and know when we have to take a break. So, without further ado, my conversation with Lesley Parrish. Hello, Anyone Can Move listeners. Welcome to today's episode, and I'm so excited to welcome our special guest, Miss Lesley Parrish. Hi, Lesley.
Hi there. Thank you so much for having me.
Of course, it's an honor. We're so excited to be able to talk to you today. How are you doing?
I'm well. I'm well. How are you doing?
I'm doing great. So glad to hear it. So I'd love it if you could give our listeners just a little bit of background on you. Tell us a little bit about yourself and your career.
Yes, ma'am. No problem. I am a licensed physical therapist. I have about coming up on 20 years of experience in sports medicine and athletics. In the last several years, I have been working, probably about the last 8 years, I've been working with a university in Southeast Alabama named Troy University. They recently, I don't want to say recently, I don't want to undercut that any, but they have this wonderful program. They have a Bachelor's of Fine Arts program, and I've been working really closely with some of the leadership in that particular program there at Troy University. And I just feel super blessed to. I always say that's kind of where I started dipping my toes into the world of athletics and dance and everything like that. I've always been in athletics. Started out working, oddly enough, in football, and I was in Nashville, Tennessee, and then moved down to Troy. And I realized, wow, there's this huge community of individuals that I was going to get to know. And I always just say it's kind of through a little bit of divine design that I ended up meeting a group of individuals out of that, and have been recently working really closely with them, doing dance and movement. And oddly enough, what has spun off of that is the use of technology in movement assessment. And so, what's super cool about it is that I've been able to kind of get the science behind movement kind of embedded in my brain. So, really, the last 5 years of my world has been dedicated to the study of movement, the diagnosis of movement dysfunction and/or derangements, and how that movement plays into different pathologies with an injury and things like that, whether it be dance community or any other type of athletic community.
Most definitely. That's so cool. And for our listeners, I think I've mentioned this before, but I attend Troy University. And so I've met Lesley before, and we've worked a little bit
Great.
together before. And Lesley has worked closely with James Boyd, who has been on our podcast before as well. So small world, all the connections make sense. But that's so interesting
Correct.
that football is very different from dance in a lot of different ways. Contact versus, well, some kinds of contact, but not as aggressive contact as football. But how did that
Agreed.
transition work for you? Did it take time to kind of get used to how like traditional athletes and dancers' bodies are different and how to treat them differently?
Absolutely, without a doubt. It was this unique kind of transition. And thanks to James. I always say that's kind of where I first got my Academy Method book. And I'm sure you guys are familiar with different types of method from the Academy Method. I think I always just say this is more the first volume of the encyclopedia that initiated my first kind of first movement into this. And I started laughing and I said, here I am. I started out in football. I started out in real high collision, ballistic, real aggressive athletics. And then I didn't step back on the ballistics. I'll be honest with you. I learned that the world of dance is just as ballistic as, say, something like football. It's just not meant, it's very different in the direction of the movement. And So kind of how I got into that was, like I said, I started out looking at different ball players and different athletes, and I started noticing different sports had different nuances. And then I started falling into, like I said, I started getting really acquainted with the BFA program and ended up having my first professional dancer as a rehab specialist. And that's where I met James. And he gave me this book. And I started digging into it. And I said, oh my goodness, they have to move very differently than, say, your standard athlete. And that was literally the start of my journey about 6 years ago. And being a bit of the perfectionist that I am, I was like, oh my goodness, this person is not going to be, it's not going to be the same. It's going to be very different. Instead of the feet being forward, it's going to be a little bit more turnout. And then I had to learn this whole vocabulary of turnout and develope and like literally speaking this whole other language. And I always say James has been critical and kind of always being my translator in that. But what's really unique is in the PT world, or at least in the rehabilitation world, is the need to understand what an athlete has to do in order to perform optimally is critical. So if you're treating a pole vaulter, you need to be able to understand what that pole vaulter does.
Right.
And sometimes that requires you to get out on the track and maybe even videotape. And like I said, I've had such great experiences with Troy University. They've let me in studio. They've let me sit in on classes and different things. And so I've learned so much about what is required of a dancer in order for them to be able to perform optimally. And it's not the same. I would love to say they're a unique athletic population for sure.
Yeah, most definitely. And I think I can speak behalf on a large population of dancers that are so appreciative that you have gone into this field and like are working to learn and understand how our sport works, because it's really intimidating going into a physical therapist's office or even a doctor's office and explaining like what hurts and what's wrong, and you say, well, when I plie it hurts, and they're
Right.
like, okay, well, what's that? Or when I do an arabesque it hurts, and they're like, yeah, I don't know what that means either. And it's like, we don't have a whole lot of other vocabulary to describe it, so it's so helpful, and it makes us, at least for me, it makes me feel so much more comfortable when somebody is, understanding what I'm saying, and
Hmm.
then like validating that and
Sure.
helping me work to fix it. So that is so incredible that you're doing that, and I hope that people can hear that you're working towards this and doing this, and maybe take some lead from you, and they so that they understand too, not just dance but for all sports. Like, it's so important to know the mechanics of all of them to be able to help people properly, because it just makes sense.
Absolutely.
So I would love to hear, because you've worked with dancers for a little bit of time, do you feel like there's any issues with pain management techniques that dancers are being taught?
Know so much about techniques. I mean, the idea behind pain management. I always say that the classic rest, ice, compression, elevation. Rest typically is more of a four-letter word for all athletes, and I say that not being crass by any stretch, but it's hard to rest. And unlike an NCAA sport. Dance, especially if you're in a Bachelor of Fine Arts, they don't have the rigorous confines of practice and rest and an NCAA regulated sport, and or high school athletics for even that. Most dancers dance for 10 to 12 hours a day.
Mhm.
Especially if they're in a bachelor's program or even a master's program, they may be in class all day and then have rehearsals late into the evening. So do I think there's anything wrong with what they're being taught? No, I think that the management strategies are the same across any athletic platform, right? So if you hurt yourself, they teach you to rest, ice, compression, elevate, use medications to kind of manage that, whether it be Tylenol or maybe some sort of analgesic and or ibuprofen or whatnot. So those acute management strategies are consistent across the board. The one unique underpinning of the dance world is literally the push through aspect, and I don't think that's unique to dance, but a lot of dancers dance in pain. Just like we teach, I don't know, we teach throwing athletes not to pitch through pain. At least we recommend it. Whether or not that actually occurs
Right,
is
maybe or
truly,
not.
truly, yeah, absolutely. Whether or not it occurs, it's dragging me out to the mound with them. But, a lot like what I have to kind of talk with dancers about is that, it's going to be challenging to be athletic. It's going to test your muscles. You're going to get sore. You're going to feel all of the nuances of being athletic. But at the end of the day, pain is pain, and pain is your body saying stop. I can't tell you, in any athletic population, they're going to ask, how can I get through this? I just need to make it to the next show. I just need to make it to the next item. And we have the conversation of, well, can you, or should you? And so I always say can and should are two different words. And so those are kind of the talks that we have, and every athlete is unique, from the sense of, should you push through an incredible amount of pain that sounds damaging? We're going to shut you down pretty quick. And I always have to kind of be the bad guy at some level and say, hey, this is a pain you should not push through. This is a discomfort that is concerning to me. And especially things that are intractable and don't go away need to be managed medically. And I have this humongous push within athletics, in the sense that, communication is really key. And I think, and again, not just in dance, but any athletics, people stay quiet when it hurts. And that's the hard part, is they're scared that it's going to put them out, or they're scared that it's going to take them out of the mix. But a lot of injuries can be managed and get you through the next event or get you through the next show.
Right.
But then there's that other side that is the tough conversation that you have to have and say, oh man, this is not something you'd be pushing through. So I think really the thing that gets miscommunicated to athletes is, it's not okay to talk about it. It's not okay to say something. That is not okay. You definitely want to speak up. And this is something that I say to dancers across the board. You guys are very different than any other athletic population. Some of you have chosen this as a career. So some of you have to dance into your 40s and 50s. And I'm 43, and I guarantee you some of the maneuvers that I've seen dance athletes do, I'm not capable of doing at 43. And so keeping that instrument finely tuned is really important. And sometimes a lot of that is speaking up when you're hurt. So I think, if anything, that is the miscommunication, and saying, it's not okay to talk about it. It's not okay to bring this up to your instructors for fear that they may not be able to perform the next time.
Right.
So like I said, I think the general principles are there, but again, communication is clutch. Very, very important.
That all makes so much sense. And it, I don't think is unique to just BFA programs, or I think it's across the board, something that happens in dance all the time. And it's definitely systemic. I can remember from a very young age, hearing about different ballerinas or famous dancers, or even dancers who I took convention classes from, saying well, I had this huge injury and I pushed through it and I danced the whole time on a broken leg or something. And we're all like, oh my gosh, that's crazy. Well, that means that we have to do that too, because we see this successful person telling us that they did it. And so that is definitely a kind of systemic issue within the dance world that has pushed on, and it's become the normal of, well, if you're in pain,
Right.
just chill out for a
Break a
minute
leg.
and literally break your leg, just get back into it. It's fine. But it's so important that we do speak up, because dance sometimes has this tone that people, especially with people who have chosen to pursue it as a career, adults will say to you, well, what's your backup plan? Because you can't dance your whole life. You can't dance into your 60s. And it's well, actually, lots of people do, and they do it really successfully. But because that kind of, people say, oh, well, you can't dance your whole life, I think that's so huge that as we're young, we're oh my gosh, I don't have a lot of time. I have to keep going. I can't stop moving. If I have to rest, that's 2 more days that I'm not dancing, and it's really that it's a myth, it's a stereotype that we can't continue dancing into older ages, as long as we take care of our body.
We've got a lot of instructors at Troy that are dancing well into ages even older than myself, and still beautiful athletes. And I don't think that goes without maintenance.
Mm-hmm.
And I think that's important for any athlete to realize, whether we talk about movement of an athlete running down a field or the movement of an athlete moving across a stage, there's always going to be some maintenance program. And speaking up about something that is uncomfortable, before it progresses. And I think that's the key, is before it progresses to this huge injury. A lot, and this kind of brings me to another point. A lot of injuries have a lot of precipitating factors that lead up to the big thing, right? And
Yeah.
so for me, it's like, why let it get there? And that's really where, and honestly, that's really where my passion is. I had a big injury. I was a gymnast for a long time. And when I retired, I ended up retiring due to an injury. And I remember thinking, had I had just done a little maintenance, would that have actually happened? Had I have, gone through a certain screening process, not necessarily a pre-participation physical, because I had those, but just maybe a movement assessment or a movement analysis prior to. And so I think maybe at this point, not having the big operation, not having the big surgery would have definitely been my preference. And what could I have done to do that differently? And I think that's kind of where my career started, was with my injury, and then being able to sympathize. But then now the into this 20 years, I've seen so many injuries, like, man, what could we have done to fix this on the front end? And I think that's what needs to be communicated to athletes, is whether, like I said, any athlete, especially performance athletes, is, hey, there is a maintenance program within what you're doing, because what you're doing is super athletic. Don't let anybody tell you any differently, because what you are is an athlete. And so you have to do a maintenance, and a lot like throwers, or a lot like any other type of athlete, they want to do their skill, but there's also a strengthening program and a maintenance program that needs to occur. And you're right, those big injuries, people push through those, but at the end of the day, it's like, why would you do that whenever you could just do a little maintenance program on the front end?
Right. Injury prevention is so important. And it's like, yeah, why would you not try to stop it on the front end rather than just let it continue to get worse and then be in an even worse position than you could be? I completely agree. So, speaking of injury
Absolutely.
and all of this, in your experience, what have you seen as the most common cause for injury in dancers?
Um, so the well, let's just, okay. So this is something that I've learned a great deal over the last 8 years. Is there are different styles of dance that are unique. There's contemporary or modern. And within those dance genres, if you will, there are several subsets of different specialists who've done certain things. So like ballet has like several subsets and different techniques that are based within that ballet technique. And then you talk about contemporary modern, and there's different artists who have led up into this giant. So these are big, broad paintbrushes. And those particular athletes who dance within those genres have specific maneuvers. So let's just say ballet. Let's say ballet. And I always say ballet is kind of your fundamentals. That's where you start in your little pink tutu, and you're two, and you've just got your first ballet slippers, and you're loving them. And starting out right there, that's kind of your foundation. And one of the things, and again, so there's several things that I've noticed. There's certain extremes of motion that certain dancers have to get into. As we all know, that's what makes it beautiful, right? Is to move in these beautiful patterns, and be able to control it. At the end of the day, those patterns are hard, and so we push ourselves through these physiological boundaries, which is good, right? A pitcher does the same thing. They throw and they throw, and they change the physiology of their body. They change the anatomy. So does a dancer, make no mistake. And there's a lot of research undergoing that right now, is looking at the way that, say, an athlete's body changes over time from skeletal immaturity as they move up through the skeletally mature phases of their career. So, talk about ballet, extremes of motion. So, that's not necessarily a causative factor, but forcing yourself into extremes when you're maybe not capable, or maybe don't have the strength to do so, or maybe don't have necessarily the good foundation to build on. I always say I can get a whole lot of information. I've just been a girl PA, just literally doing fundamentals from a movement assessment, from a therapy standpoint. I'm not a technique guru. Don't even get me there. That's a whole nother area. But so there's that,
Right.
right? There's the fundamentals and the mechanics behind it, and then the conditioning side of it. If you have an athlete that's somewhat deconditioned, the pandemic has brought on a lot of deconditioning, especially for the performance world. I feel like a lot of that got put on hold for the last year. So as we start to see athletes jump back into the entertainment world, we're seeing some unique injuries that are coming from the deconditioning behind it. And kind of lastly, as I get into it, is looking at overuse. I see a ton of overuse. Just from, like I said, there's really not a whole lot of regulations. You can be in a BFA program and dance for 9 hours a day in class, and then still have 10 hours of rehearsal after that, without a break. And kind of educating people how to fuel that amount of, like, whether it be, nutrient fuel into the body to be able to fuel, I don't know, a 10-hour day on your feet, much less in a very high caloric intake, high cardiovascular situation. So, again, fueling that and then going through that, your body will start to consume itself if you go for a long period of time. But for the most part, like I said, it kind of gets out into that, from the technique standpoint down to the fundamentals. Do we have good fundamentals? And then also, how long do we train in a day? We talk about runners. How much do you run in a day? How far do you run? If you run 50 miles in a week, I kind of think of that as like a ballerina. That's a very high cardiovascular endurance sport. And
Right.
track and, endurance running, if you look at their heart rates and their blood pressures, they have low blood pressure, low heart rates, much like an endurance athlete. So again, we'll start to see some overuse type stuff with them. So I guess there's a multi-tiered approach. I ask a lot of questions. I really listen a lot to the dancer whenever they start to come and see me after they have an injury.
So true. And I think I know I've experienced, have had friends who have experienced this where we're in a lot of pain and we go and we're like, we know something is wrong, like there's something wrong. And they tell us, yeah, it's overuse. And we're like, what do you mean? And just overuse. Like, that's like, that can't be it. And it's like, no, that's it. Like, you're on your feet all day. It's definitely overuse. And so that's we've talked a lot about on the podcast the type A personality of dancers, how we all tend to be perfectionists. We all tend to, push past our limits and have these really high goals to achieve. And with that comes pushing ourselves to our physical limit as well. And that can so often lead to overuse and, like we talked about earlier, pushing past our injuries and things like that. But I loved how you brought up, different genres of dance and how, like, if you're a tapper or a ballet dancer, your body can develop so differently and the issues that you're going to have are going to be different, because a lot of people don't. And we have listeners who aren't dancers, and so I like to explain that it's not just dance as this one thing. There's so many different branches that have different leaves on them that, like, go off into
Absolutely.
themselves. And so that's such an important point to make. I completely agree. So how does injury prevention?
And Caroline, truth be told,
Go
oh, I'm
ahead.
so sorry.
No, you're good. Go ahead.
Go ahead.
No, you go.
No, I was just going to say, but it took me digging into the sport to learn that. I did not know that organically, nor is that anything that you can read in a book. You have to kind of really educate yourself regarding the different genres, because if you just think everybody's ballet, that's going to be very different than somebody says clogging or even hip hop. It's going to be hip hop's more like acrobatics.
Yeah.
So again, it is very unique to the genre of the sport. It's like being a pitcher on a baseball team versus being a catcher or an outfielder.
Yeah, they're right. Yeah, that's so true. That is another thing that we've talked about a lot, is that sometimes dance can seem like it's gate kept a little bit, like we're our own little clique, and like nobody really knows what's going on in there. Nobody knows the ins and outs, and it is hard to learn about it sometimes, because it's not like it's all written out in this one book that like kind of differentiates genres and like explains different things. It's just something that when most of us have grown up in it, you learn it over time and it becomes second nature. But
Right.
it's so incredible that we have people like you who are interested in it and are learning about it actively, because it makes our lives so much easier and it's so helpful. So we talked a little bit about injury prevention earlier. How does injury prevention with dance differ from injury prevention in other common sports?
For sure. So dance is different, obviously. I'm sorry, I'm losing my earpiece. So dance is just slightly different. Excuse me. It is different from any other athletic type activity. So for me, at least what I have noticed whenever I'm talking about injury prevention, I am thinking about the commonalities. So there are some common type injuries to dance, mostly lower extremity and lower back type injuries. And then I start thinking about the muscle groups that could potentially be involved. as a precipitating factor for those. Like, for example, let's just talk turnout. Turnout is a hot button issue in dance. Everybody likes to have this high turnout. So a dancer who grips the floor and forces turnout versus using the rotation at the strength about the hips. So that can kind of be two things, right? I'm now causing force vectors to go through the medial aspect of the knee and or kneecap and or patella. And so we now are stressing the structures about the knee. And so we'll start to see, maybe even, terrible stuff like ACL ruptures or medial patellofemoral ligament ruptures, where they have to have large reconstructive procedures with physicians. So, gripping the floor or excessive pronation at the midfoot is a commonality. So what I've started, and honestly, with a lot of help from a lot of dance professionals kind of educating me, it's like, hey, this is something that we have to do. And I was like, okay, well, these are the muscles that are involved with this. And I'm like, okay, great. And, it's not as simple as hip external rotation. It's pelvic control. It's adductor control. It's so many different muscle groups. So really my practice of injury prevention has been focused around, controlling the forces about the knee and the foot and strengthening up the hips. And again, that's just one aspect of it. But from an injury prevention standpoint, I'm kind of taking the common injuries that occur in the dance world and kind of looking at, okay, how could this potentially end up in injury? How could the weaknesses and or tightnesses end up in different injury situations where we're having to see a rehab specialist and or a surgeon and or a physician? Another thing that is unique to dancers is, they have a hypermobility. A lot of them are extremely flexible, which makes them beautiful dancers. That we have a scale called a Baton scale, which is an assessment of how hyperflexible. It's a 9-point scale that we look at with people. It, has to do with hypermobility at other joints in their body. And the excessively mobile people need to have the stability balance of the musculature. And so those people who have a lot of mobility need to balance that. I always say you got to put a little yin back in the yang. So you got to have that counter force with the musculature of the pelvis and core and hips and or knees and things like that. So again, it's unique to each specific dancer. The other side of this is tightness. Turnout, obviously, and what I mean by that is hip external rotation and or forefoot eversion and knee external rotation. So rotation about this axis, if you will, causes unique little nuances and tightnesses about the hip joint. And so if that tightness is not addressed, so if you're too tight in certain muscles, those muscles have, skeletal bone attachment sites, and that bony attachment will start to get irritated because the muscle can't, or at least the tendon is not, or the muscular tendinous junction is not elastic enough to kind of allow normal movement, normal movement to occur. So what we try and do is, I always say, and I'm oversimplifying physical therapy, but we strengthen what's weak and we stretch what's tight. And really and truly by doing that, we create a balance. But what you have to remember is these dancers have to move into these postures. So they have to have the strength to move it into those, that particular posturing that they have to get into. What I don't want them doing is tugging at ligaments or tendons or forcing rotation. I would just love for you to be able, and actually James and I have gone into this at great detail, that there's certain movements that you should be able to activate muscles to be able to do rather than tugging at things. And so really addressing that imbalance is kind of where we go for dance. And that's the same across the board with most athletics. It's just that dance has a unique need for certain muscles to activate. For example, y'all talk about high brevis. Really, I've learned that that's abdominal control, adductor control, really drawing that pelvic floor up and bringing the pelvis into this neutral position. And there's a lot of dancers who don't know how to activate that. So we use a lot of technology to be able to give them a little bit of visual feedback. It's like, hey, let me show you what you need to do. Let me show you the muscle that you need to activate. Let me show you turning it on. And all of a sudden something clicks and it's like, oh my goodness, I'm not even turning that on. How do I do that? And there's this thirst for knowledge on how to be able to do that. So, and like I said, we've leveraged a lot of technology to be able to get that to go, to be able to make that happen.
That's so incredible. And, I before I was in a BFA program, I had no clue about anything about activating my muscles. It's just not something, especially growing up in competition dance, you're not really taught about anatomy or how our body is structured, and that we are moving our body in ways that it was not designed to move in. And so even just learning in class like about the hybridus, and this is what you should feel when you're doing this. If you're doing it properly, if you feel this other muscle activating, then you're not doing it properly and you could possibly hurt something. It's so important, and it should be taught at a younger age, because it could provide some injury prevention for younger dancers in competition and studios, who they're sometimes extending their muscles and pushing past their flexibility limits with tricks and things like that. But you mentioned a little bit about technology. Could you tell us about some of the biofeedback technology that you've been working with?
For sure, for sure. We have, and honestly, like I said, in conjunction with Troy University, they have allowed me to play a good bit. I always say I bring in my toys, and I think they kind of like go, "Oh gosh, more toys." But right now, currently, I'm using what they call a wearable inertial measurement unit. This is a three-dimensional device, and I've used lots of wearables in my career. I don't have any permissions to say the type of devices that I'm using right now, but or at least the name of it. They're copyrighted. But at the end of the day, I've been using these devices to benchmark movement. These wearables actually can can get varying degrees of angles. So within a three-dimensional plane. And so whenever we're a physical therapist, we're taught to break out our little goniometer, I'll call it our exaggerated protractor. And we get out, we measure angles. And those are very difficult angles to measure. You know what I mean? Those are very difficult angles to measure when somebody's standing at a ballet bar doing a develope. And I'm
Right.
thinking, how am I going to get my little goniometer attached to them? So essentially, these wearables give me that information via a radio frequency and or a Bluetooth connection. And that Bluetooth connection can create a 3D avatar of that particular person moving. And I can slow it down, I can speed it up. I can make the sensor move in certain ways to kind of give some feedback or some output. Um, at the end of the day, the other thing that these particular devices give me is how fast they're moving. What is the angular velocity with which they're moving into these extremes of motion?
Right.
I've noticed dancers who are extremely skilled that can move into these high ranges of motion have this incredible amount of control. The ones that I see, I always say the least injured that I see are the people that can get into these motions and really stabilize. And it's crazy the amount of stability these athletes have. For example, if a person's moving into plie, they're going up and down, right? So they're moving in three different planes. They're moving, they're kind of turning out. So they're moving in that plane, and then they're going up and down. So they're moving in a vertical axis. And then they're also moving a little bit because they're kind of stabilizing themselves into a front and back motion, because we try and stay just a little bit pitched forward in the dance world. And then not to mention, we're also rotating in this horizontal plane. So we've got this X, Y, and Z axis mobility that is occurring as in most athletics. But again, what's unique in dance is that they're trying to take it to the extremes. And so they take it to this extreme Y or this extreme X or even the extreme, Z motion. And then they can get out there and they can hold it within a degree. It's quite remarkable. I mean, like they can stand on one foot on just point, or at least an elevate, where they're standing on like maybe just 3 inches wide platform, and they're not moving but maybe 5 degrees. It's really quite impressive. And so what these wearables give us is exact degrees of movement. So we're kind of leveraging this scientific technology to kind of give us an idea of how well the dancer is moving within a three-dimensional plane, and not only how well they're moving, how fast they're moving. And so what's really unique about that is I can create this avatar. And what we've been compiling over the last several years is using these wearables. And now we've kind of got an idea of what elite looks like, what developing looks like, and what novice looks like. I hate to give people rankings, but at the end of the day, what's really unique is that now I can give them, hey, we're kind of functioning doing this movement at a novice level. This is what this looks like. And we can actually create alarm systems with the device and say, okay, I want you to move here, use this, use this, use this, move this way, move this way. Nope, don't move that way. It'll give you like a little negative, almost like a little ping if you're moving in the wrong direction.
Yeah.
So we can use these wearables both diagnostically and exercise driven as well. The other device that we've been using a little surface EMG or electromyography. And basically, we put these sensors on top of the muscles and create like a system where it lights up. And this light up system or activation system or noise system, and honestly, there's tons of these devices that live about, but we've just kind of started using them for dance, to be honest with you, because it's such a unique population. Being able to activate those muscles. So high brevis, for example, activating these muscles. A lot of dancers, like you said, are not taught that at a very young age. So to be able to see when that muscle turns on, either visually or auditory wise, is critical, because they've done it so much one particular way that motor memory wants to stay that way. But then when you teach them how to do it the correct way, it's very unique. And I've worked with some athletes who were kind of dealing with a little nagging pain, right? Who weren't pulling up into high brevis. And literally I said, okay, we stuck the EMG on them. And I said, I need you to turn that muscle on when you do that. And when she did it the first time, she's like, I am turning that on. I don't know what you're talking about. When she did it, she's like, that thing didn't even move. Like, you didn't even make a noise. It didn't even register. And she's like, really? And when she did, her foot pain went away. And so it was just, it was like almost like a light turned on for her. She's like, oh, I was doing that wrong all along. And I thought I was doing it correctly. So again, leveraging the technology that we have, because we've got some brilliant scientists out there, leveraging that to show a dancer, hey, you need to move this way, or hey, you're moving this way, and this can be pathological or this can be detrimental. I'm hoping can prolong an athlete's career and or potentially prevent injury from them, hurting further, or at least prolonging an injury into something bigger.
Yeah, and that sounds like it's exactly what it's doing. That visual and auditory learning is so huge. It's everybody learns differently, but usually one of those two is involved in how somebody learns the best. And so, especially with like these teeny tiny little muscles in our bodies that we can't see on the outside, and sometimes it's really hard to feel them, having a little avatar of yourself or a noise or even like a physical like feeling that notifies you where to engage. I'm sure that has been completely, and I'm sure for you, like seeing those aha moments of people getting it is so rewarding
Mhm.
too.
Well, honestly, the most rewarding thing is to watch the shows that they perform in, and they're not running all over stage, like they're not taped up and everything, at the end of the day. So that's the most rewarding thing is, and as a rehab person, as a physical therapist, that's our ultimate goal, is to put you back out there. I don't like not, I always say my job is not done until you're out back there doing what you want to do.
Yeah.
And so, like I said, I'm going to use all my cheat steps, if you will, to kind of make sure that occurs. And if it means that and again, people learn differently. People are tactile learners. Some people are visual learners, and being able to leverage different things to be able to address, hey, this person's a visual learner. Let's do this. Hey, this person's a tactile learner. Let's do this. And so, especially in the advent of more like this type of communication,
Yes.
we were looking at I was talking to a dancer via Zoom the other day, and I remember saying, hey, do that again. And I needed my tools and my stuff to kind of to be there. But again, leveraging that technology has been really amazing.
So huge, so huge. Yes. And so seeing as how you like seeing people like recovered and everything is so rewarding. I would love to know if you have any advice for dancers listening on how best to approach their own pain management and injury prevention.
Say that question one more time. I'm so sorry. I
Oh,
cut out just a little
no
bit.
problem, no problem. So I would love to know if you had any advice for some of our dancers who are listening on how they should approach their own injury prevention and pain management.
Oh, I love that question. That is such a great question. As with any athlete, I think, well, first off, everything's going to be somewhat unique to your body, and unique to your genre. I mean, at the end of the day, if you're a hip hop artist, you're definitely going to want to have some upper body strength. That's, like I said, that's very acrobatic. So I think an overall conditioning program is important. An overall dance specific strengthening program is extremely important. Recently, we were approached by a new studio owner, and kind of looked at me and said, "Hey, I want to add this into our studio as far." And I was like, "Man, we can give you kind of like a global approach." But what would be really great is if we could give each dancer a unique approach, say, hey, this particular muscle's weak on you and this one's strong. But again, if you don't have access to a professional like that, I think looking up certain dance specific strengthening techniques, there's a lot of stuff out there right now. There's a lot of dance professionals out there. There's a lot of people who are getting into this. There's a couple of medical associations. Performing Arts Medical Association is one of them. That's a great website for you to check out if you're interested in kind of building your knowledge. But again, getting into some sort of cross training is going to be really important. Remember that the sport that we're dealing with here is very aerobic. That aerobic conditioning and that aerobic strengthening is very important. That we do that with all athletes. We try and get them into a cross training and or conditioning program. And please don't discount, please don't discount the effects of rest. And what I mean by that is not like sitting on the couch eating, potato chips or something. I really do think like a good active recovery, whether that be a stability program, a flexibility program, a strengthening program. Sometimes I'll even just encourage people, get in the water and swim, do ballet in the pool, things like that. Some sort of cross training program and rest and some sort of recuperative rest is important. Taking breaks after a big show is really, really, really important. And again, what I mean by rest is truly a restorative rest, not necessarily just becoming
I
deconditioned, sitting
know.
still.
Right, exactly. That's such incredible advice, and I'm going to take it personally. And that I know it will benefit so many people who might not have a full team or professionals who are there to help and assist them. Well, Lesley, thank you so much for being on today. We so appreciate having you and getting to talk to you. And you've just given us so much great information, and I really appreciate it. I would love it if you could tell our listeners where they can follow you, if you have any new projects coming up, just share with us anything about your future. Yeah.
Absolutely. Definitely. You can, well, I'm here. I'm a physical therapist here in Troy University. You can reach out through email at lparish@troy.edu. Just reach out to me if you have anything or any questions, comments, or concerns. Email is typically the best way to do that. I think at this point in time, I've got some projects coming up that we're going to start digging into. And I hope to kind of get some of this information out to Caroline whenever it becomes available to share. But
Yeah.
for the most part, we're actually digging into some really, really unique situations and we're kind of on the cusp of doing something really, really neat in this area as far as like injury prevention, strengthening, and bringing some unique things to this Southeast Alabama area. But again, I really, really hope that we can kind of share those in the near future. But again, reach out to me. My name is Lesley Parrish. I'm a licensed physical therapist. It is LPARRISH at troy.edu.
Perfect. Well, Lesley, and you heard that here first, folks. Stay tuned for big announcements coming soon. Well, again, thank you so much. We so enjoyed having you on today, and I hope you have a great day. Bye.
Thank you. Same to you.
Well, I just loved getting to listen to that conversation back with Lesley and I and just hear so much about I love speaking about, my own experiences with dance, and hopefully somebody out there can relate to them in some way, shape, or form. And hearing somebody who is not traditionally from a dance background, who has taken that step to learn more about dance and to help people with things that, especially dancers, that we don't know about inherently, we aren't trained to know about, and also bring light to the fact that we should be taught about them. We need to be educated about our bodies and how our bodies work and what soreness pain is and what injury pain is. I just so respect her for coming into our field, and I'm so glad that she's been welcomed with open, loving arms into this community. Of people that she's able to help and to serve. And so that is just, I think, so awesome that we got to talk to her and that she was able to spend some time with us and share a little bit of information with everybody about this really important topic. Well, that is all that I have for today. And as always, remember to keep moving, stay curious, and stay confident. Bye bye for now.